Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. We are privileged. Yeah. Um, Welcome to Dr. Mithuna. Good evening.
Good evening, sir. Good evening to all.
Yes. So we have taken 200, one of the stock questions which are frequently asked, and we are going to have the discussion. Mithuna has also solved the paper and going to give some of the answers, and we'll make it more a group discussion format. Can the online students can punch? Is the voice loud and clear? Can you please punch, doctor? Uh, is the voice loud and clear for all of you? Good to see Ganesh and many more who are all online. Let me drop a word to all our students that we are online. Yes, sir. Good. Thank you, Madhu Chandana, Meghasvana, Ganesh, and many more. Voice loud and clear. So, doctor, HCG is secreted by?
Syncytial trophoblast, sir, which is a part of the placenta.
Very good. Safety muscle of the tongue, which muscle is called?
It is genioglossus, sir. It's that fan-shaped muscle occupying the major part of the tongue muscles. So it is starting from the from the mandible, and attaches itself to the inferior portion of the tongue, and also the hyoid bone. So it keeps the whole point of genioglossus is to protrude the tongue out, hence keeping the airway patent. Hence, it's called a safety muscle.
Good. Adam's apple fundamentally is due to what?
It is thyroid cartilage, sir.
Very good. And trigone of the bladder, from where is it derived from?
Trigone of the bladder is derived from the distal part of the mesonephric duct, sir. But if you take bladder as such, it comes from urogenital sinus. But the distal part of the mesonephric duct forms the trigone.
Very good. So the end of the mesonephric ducts become incorporated into the bladder wall, and that forms the trigone, is what you should remember. Now, can you identify the structure which is being pointed here?
It's the pubic symphysis, sir, between the two pubic bones.
Very good. So this is one thing that you need to know. The crustophylium, the fifth lumbar vertebra, the acetabulum, the femoral neck, greater trochanter, lesser trochanter, the femur, and this is the ischial tuberosity, the superior ramus of the pubis, obturator foramen. So the fundamental pelvic radiograph. Now, in patellar tendon reflex, which muscle tendon is stretched, doctor?
It is the quadriceps femoris, sir. Patella tendon reflex is nothing but knee jerk. So quadriceps femoris is rectus femoris, vastus lateralis, vastus intermedius, and vastus. I'm missing one.
Medialis.
Radialis, yes, sir. All these form quadriceps femoris. That is the
Very good.
patella tendon.
So basically, rectus femoris is supplied by the femoral nerve, is what we need to remember. From where is the melanin derived, doc?
It is thyrosin, sir, which is in turn produced by phenylalanine.
Good. Tyrosine become dopa, dopa become dopamine, and dopamine is the one which ultimately become the melanin. Now, a female has galactorrhea, amenorrhea, diagnosed with pituitary adenoma, now complains loss of vision. So what kind of visual field defect do you get in pituitary adenoma?
It is a central tumor, sir. So it is compressing the nasal, the optic chiasma. So the nasal fibers, which are showing the temporal field, are crossing over. So bitemporal hemianopia is what we see.
Very good. So whenever left optic tract or lateral geniculate body or optic radiation or visual cortex, then you get right homonymous hemianopia. Similarly, temporal lobe lesions lead to superior right quadrant anopia, which is called the pie in sky is temporal. Pie in sky is temporal lobe. And macular sparing typically occur whenever there is any lesion in the visual cortex in the occipital lobe is what you need to remember. Very good to see 12 online classmates. So we want to make these sessions more interactive so that you won't feel bored about monologue of the teacher. Any of you like to volunteer to participate in this online broadcast directly and give answers? Please do let me know. I will send you the questions, answers, explanations, everything to you beforehand. You can prepare and then join the group discussion. Now, where is testosterone produced, doctor?
Testosterone is produced by the Leydig cells, sir. The Sertoli cells take care of the maturation of sperms.
Good. So, subtly cells are more into supportive role, structural role is what you need to remember. And Leydig cells are the ones which produce the testosterone. Very good. Fertilized egg is
Fertilized egg is a totipotent because it is capable of forming the whole organism. So
good. Now, this marked artery, which you are able to see in the leg, what is this made up of, doctor?
it is the posterior tibial artery, sir. So that's a part of the structures going below the flexor retinaculum.
Very good. So you have flexor retinaculum. Underneath that, you have the posterior tibial artery, the tibial nerve, and
And Tom,
flexor
Dick, and Harry, sir.
retinaculum. Yes. Flexor retinaculum runs between medial malleolus and calcaneus, and underneath you have all these things. Then celiac artery is seen at which level?
It's a T12, sir. Lower border of T12.
Very good. So typically, the celiac trunk is the artery of the foregut. It supplies the lower one third of the esophagus. Also, up to the second part of the duodenum, up to second part of the duodenum. It lies behind the lesser sac of peritoneum. And what are the three terminal branches, doctor, for celiac trunk?
It is the left gastric artery, splenic artery, and hepatic artery, sir.
That's very important to remember. So all these different arteries, what is the level at which they originate is one of the favorite questions of the examiner, doctor. So inferior phrenic vein, hepatic vein is at T8. Right suprarenal vein and the renal veins occur at L1. Right gonadal vein is L2. Common iliac vein union occur at the level of the L5 is what you need to remember. More important is the arteries. Common iliac artery bifurcation occur at L4. Inferior mesenteric artery originates at L3. Superior mesenteric artery originates at L1. Renal arteries originate at L2. So, and celiac trunk is at the level of the L1 at the lower border of the T12 is what you have to emphatically remember for the tomorrow's exam among the surface markings. Now, doctor, highest point of iliac crest is at which level?
L4, sir.
Very good. It is at the level of the L4 and the fourth lumbar vertebra. So all the surface markings is one of the favorite area for the examiner. Now, a 45-year-old policeman comes with a complaint of pain in the right leg, in the right buttocks, popliteal fossa. pulse is absent, whereas the left side it is normal. So at which level probably is the block?
This is at iotoiliac junction, sir. You have a horseshoe thrombosis.
So this is called Lerich syndrome.
Lerich.
So Lerich syndrome is aortoiliac junction. Whenever there is any atherosclerosis or blockade, then the blood supply to the buttocks decrease that lead to gluteal muscle claudication. Typically, similarly, impotence also whenever the Lerich syndrome occur is what you need to remember. So, buttock and hip is aortoiliac disease. Lerich syndrome, what is the clinical triad? What is the clinical triad, doc?
It's a claudication, gluteal claudication, absent femoral pulse, and erectile dysfunction leading to impotence.
Very good. And upper two-thirds of the calf is?
So superficial femoral artery.
And lower one-third of the calf is popliteal artery, and the
Popliteal
foot
artery.
claudication is tibial,
Peroneal.
is what you need to emphatically remember for the tomorrow's exam. Now, doctor, in myopia, where will image form?
Myopia, big eyes, sir. So it is anterior to retina.
Anterior to retina. So if the normal image falls on retina, in myopia it falls before retina, and in hypermetropia behind the retina. Now tell me, doctor, large-eyed people, what will they have, myopia or hypermetropia?
Myopia, sir.
Very good. And small-eyed people like infants typically will have
Hypermetropia.
hypermetropia. Now, the muscle which is being shown in this illustration, what is the nerve that supplies?
It is biceps brachii muscle supplied by musculocutaneous nerve.
Very good. Biceps brachii is musculocutaneous.
It
And what are the
also supplies
lead to supination of the forearm? I mean, the forearm, doctor?
actually, whenever it is extended, it is the supinator muscle. If it is flexed, it is the biceps brachii muscle, which causes supination.
Very good. Supinator is supplied by
Radial nerve, sir.
radial nerve. Radial nerve. So that's what we need to remember. So musculocutaneous nerve supplies three muscles. What are the three muscles supplied by the musculocutaneous duct?
It is biceps brachii, brachialis, and coracobrachialis.
Biceps brachii, brachialis, and coracobrachialis is what we need to remember. And what are the three important functions of the biceps brachii?
It is the supinator whenever we flex our arm, our hand, arm, and flexor of the elbow. Also, weak flexor of the shoulder.
Shoulder. So what is this structure that you are able to see here?
It is the pterion, sir, which is formed by the four bones. It is the sphenoid. It is the squamous part of the temporal bone, parietal bone, and frontal bone. It is the weakest part of the lateral side of the skull. So below to it, just below it, you have the anterior branch of the middle meningeal artery, which can lead to extradural hemorrhage.
Very good. It is the middle meningeal arteries anatomical surface marking is what you need to basically remember. Middle meningeal artery is a branch of?
It is a branch of maxillary artery, sir.
Very good. It is a branch of the maxillary artery. Now let us quickly revise, doctor, the various branches of the middle meningeal artery. Now, before lateral pterygoid, there are 5 branches. So what are the 5 branches before lateral pterygoid?
It is the superficial temporal, deep auricular, anterior tympanic, middle meningeal, and inferior alveolar.
Very good. And what are the branches which are lateral or within the lateral pterygoid?
It is deep temporal, buccal or lingual arteries and
Very
muscular
good.
branches.
And what are the branches of the maxillary artery beyond the lateral pterygoid, doctor?
It is the sphenopalatine artery, sir. Greater and lesser palatine. Uh, f- uh, Palato-vaginal canal से जा रहा था. Oh, हाँ. Pharyngeal artery. Infraorbital, sir. Intraorbital.
Very good.
And
So,
posterior superior alveolar artery.
so maxillary artery branches are some of the uh, favorite topics of the examiner, the maxillary artery branches before the pterygoid, after the pterygoid, and beyond the pterygoid, you need to be very clear about. Now, doctor, good to see 12 online classmates. So, lacrimal gland is supplied by which ganglion?
Pterygopalatine, sir.
Which ganglion?
Pterygopalatine, sir.
Very good. Pterygopalatine. So already many times we discussed pterygopalatine is secretomotor, and it is the superior salivatory nucleus, lacrimal nucleus, and through the facial nerve, it will be forming the greater superficial pituitary nerve, and it enters through foramen lacerum. It joins the deep pituitary nerve, which is carrying sympathetic fibers to form the Vidian nerve, passing through the pterygoid canal, reaching the pterygopalatine fossa, and ultimately the postganglionic fiber supply, lacrimal, nasal, and palatine glands is what you need to remember. So this is the greater pituitary nerve, which ultimately supplies lacrimal gland, nasal cavity, nasopharynx, and the palate is what you need to remember for the tomorrow's exam. Now, doctor, a lady with 50% burn of dermis, subcutaneous tissue, comes to emergency. Burns can be classified as
It is second degree deep. 50% dermis deep subcutaneous. So, sir,
good.
according to this table, the next table, sir, I thought it is full because it's involving subcutaneous tissue. So,
Um, Fundamentally, as this table says, you have superficial, superficial partial, deep partial, and full. Other way of classifying is first, second, and third degree. So here there is 50% burn of dermis and subcutaneous tissue, right? So uh, because dermis, you have one papillary area which is upper part and reticular area which is lower part. So it is only involving what?
the
50%, right? So then that should make it more like a superficial partial. You're right. Rather than second degree, it's basically second degree, but it makes it more superficial because only 50% is involved, right?
it's a, he
So we need
says
to
even
check
subcutaneous tissue is involved.
the point is no, subcutaneous anyway will be involved. Above the level
It's
of dermis only you have the subcutaneous, no? Subcutaneous tissue.
hypodermis, sir.
Huh? Okay,
It's
hypodermis is
hypodermis.
also all right. All right. Subcutaneous tissue is below the level of the dermis. All right. So here it is being given as subcutaneous tissue is also involved, and that should make it then a third degree burn, right? Okay, correction taken. So first degree burn is confined exclusively to the outer surface, antimicrobial, and second degree can be superficial, mid, or deep, and so on and so forth. So this comes more like a because of the subcutaneous tissue involvement that falls under third degree burn would be the correct answer. Correct. Now, with regard to the condition being shown here, what is this condition, doctor?
It's a testicular torsion, sir.
Do you like to treat testicular torsion as an emergency or elective?
It's an emergency, sir. It has to be opened up within 6 hours so as to save the testis. But
Immediately.
yeah. If it is late, we have to remove. We have to do orchidectomy along with orchidopexy of the other testes. You have to get it down and fix it to the scrotal wall. That doesn't undergo a scrotal torsion, testicular torsion.
So this is called the whirlpool mass effect, where whenever you do the ultrasound, then it looks like the torsion of the cord typically looks like a whirlpool appearance is what we need to remember. Now, a 20-year-old female diagnosed previously with adenocarcinoma of the stomach, and you are able to see this lesion, right? So, what is this called?
This is Sister Mary Joseph nodule. Also, sir, you also see a supraclavicular verchose node in a stomach carcinoma.
Correct. Which is called Troisier sign. Troisier sign.
Troisius, yes, sir.
Don't use that way. Troisier sign. Troisier is what you see in case of
Hypocalcemia.
calcium,
Hypocalcemia.
hypocalcemia. 20-year-old girl, distal ileum was removed. Which absorption become deficient in her?
It is bile acids, sir, and B12. The option is not available, sir, in this.
Correct. So, bile salts. Correct.
Bile
Now,
acids, sir.
62
Bile
years old.
acids and B12 in the terminal ileum.
Correct. Vitamin B12. Because iron is more from the duodenum.
Duodenum, yes, sir.
Yes. Then 62-year-old female has kidney stone. You treated with percutaneous nephrolithotomy. After 2 days, she again comes to OPD with chills and fever. What's the possibility?
It is sepsis, sir.
Very good. It's a bacterial sepsis which can occur post-operatively. Whenever any stone which is infected can lead to the development of the post-operative fever. So, what are the complications of PCNL?
Firstly, injury, hemorrhage, sepsis can occur post-operatively. Then all that retained stone fragments. Sir, I think this is lithotripsy, kada, sir. Not lithotomy.
Lith- Percutaneous nephrolithostomy.
Lithostomy. Okay.
Lithotomy.
Okay.
Yeah.
Okay, sir.
Now, identify this condition which is being shown, doctor.
This is the port wine stain, sir. Struge-Weber syndrome.
Very good. So typically, port wine stain called Nevius flameus, and we use pulsed dye laser to treat port wine stain. Abdominal pain, fever, and jaundice. What do you call?
This is Charcot's triad, sir.
Which is found in
Uh,
cholangitis.
col- cholangitis. Any gallbladder pathologies?
Not gallbladder. This is bile duct. A lot of people confuse
Cholangitis.
between cholecystitis and cholangitis.
Cholangitis.
Cholecystitis is gallbladder inflammation, whereas cholangitis is the bile duct inflammation, is what you need to remember. So, Saint's triad, you need to remember. So, what is the triad in Saint's triad?
It is gallstones. It is diaphragmatic hernia. It is diverticulosis of colon.
And all the three are the consequence of obesity. When obesity is very high, then cholesterol gallstones form. And typically, obese people take a very little fiber in their food. That's the reason diverticulosis of colon can occur. Similarly, there can be an associated hiatus hernia, is what you need to remember. So, what is meant by Reynolds pentod, doctor?
This is having five things. So it's a Charcot's triad plus shock and altered mental status.
So it is the shock, altered mental status, right upper quadrant pain, jaundice, and fever together is called Reynolds pentod, is what you need to remember. 40-year-old patient with femur fracture with pulmonary infiltration with respiratory distress.
Fat embolism, sir.
So it is the fat embolism which is very classical. Which patient has got a better prognosis in the breast cancer?
It's luminal A.
So fundamentally, based upon the molecular subtypes, there is a division into luminal A, luminal B, those who are HER2 positive, and luminal A,
Doctors.
those who are ER positive, PR plus or minus positive, HER2 negative, and Chi67 is present in less than 14%. So luminal A, luminal B, HER2 plus and TNBC, you need to be very sure about. So whenever there is a luminal A, then the estrogen modulators, their therapy is sufficient. So luminal B are HER2 negative. So in them, chemotherapy is also required. When HER2 positive, then you can give trastuzumab like drug, which is anti-HER2, is what you need to understand. So luminal A is the best overall prognosis. Luminal B are ER HER2 positive, intermediate, and HER2 positive. Then okay, the luminal A and luminal B be very sure about. Now, doctor, yes, long-term diabetic patient walk few miles in hot sand. After that, blister forming is seen on the foot. So, what is your
This is necrotizing fasciitis, so you can see necrosis here very clearly.
very good? A man presented to emergency with head injury. So, what is the best investigation you want to do?
It's non-contrast CT, sir.
Non-contrast CT. So, non-contrast CT can enable you to know all the potential surgical brain injuries. Similarly, whenever a patient presents with stroke, acute stroke, once more it is the NCCT. With this, you can know is it a ischemic stroke or a hemorrhagic stroke. If it is a hemorrhagic stroke, it is a contraindication for thrombolysis. If it is an ischemic stroke, if he is within the golden period of 90 minutes, then you can do the thrombolysis is what you need to remember for the tomorrow's exam. So online students keep punching the answers, doctor. Can you please mention, is the voice loud and clear for all of you? So Alvarado score defines?
It is for leukocytosis, sir.
So in Alvarado score, 2 is given for leukocytosis. Only 2 things in Alvarado. Alvarado is in the appendicitis. We use the Alvarado score. Migration of pain, anorexia, nausea, tenderness in the right lower quadrant, rebound pain, elevated temperature, leukocytosis, WBC shifted to the left. Out of that, leukocytosis is given to tenderness of the right lower quadrant is given to. So tomorrow, NEET PG examiner, INICET exam, this is one of the hottest area. One score will come. In every INICET exam, you need to be very sure. Only 2 things have the score of 2. Tell me, doctor, what are they?
One is leukocytosis. The second is pain in the tenderness in the right lower quadrant.
Right.
Yeah, right iliac fossa.
What is the early investigation of choice whenever genital TB is there?
It's the early morning urine sample, sir.
Very good. So the gold standard to isolate mycobacterium is in the urinary samples is what you need to remember. So one question compulsory on TB, doctor. It can be pulmonary TB, bone TB, genital TB, TB meningitis. One question on TV. Entrance is not for 200, only for 199 because ek rahega TB in the tomorrow's exam. Now, doctor, true about Crohn's disease.
Uh, except is rectum is involved. So rectum is involved in ulcerative colitis, but not Crohn's. Crohn's can involve, but rarely. It's mostly the cecum and ileum which is involved in Crohn's.
Very good. So Crohn's can involve any part of the GIT. Ulcerative colitis involve only colon. Skip areas
In
typically
Crohn's,
in Crohn's, but continuous in
ulcerative colitis,
rectal sparing is the feature of
Crohn's.
Crohn's. Non-caseating granuloma, so rectum is not involved, rectal sparing is seen.
Yeah.
Non-caseating granulomas are a feature of Crohn's. Transmural inflammation, fistulae, abscess, strictures,
Pictures.
and ileum and cecum commonly involved, and perianal disease also in Crohn's is what we need to emphatically remember for the tomorrow's exam.
Also, adding one point regarding the malignancy, sir, colon cancer is more common with the ulcerative colitis rather than Crohn's.
Very good. Colon carcinoma is more common in ulcerative
Ulcerative
colitis.
colitis.
Very good. Now, the patient underwent gastrectomy after eating within 20 minutes, sweating, diarrhea. What is this?
This is early dumping syndrome. So, because he's mentioned 20 minutes, if it is 2 to 3 hours, it's late dumping, which is very rarely seen. And it's especially seen in type 2 gastrectomy, so where you connect the remaining portion of the stomach to the jejunum. You're leaving a blind, sutured duodenum.
Very good. So, early dumping 20 to 30, late dumping 2 to 3 hours. Now, what are the symptoms of early dumping, doctor?
Early dumping, the thing is that the food just without getting digested just enters directly into the jejunum. Suddenly all the fluid is being taken into the lumen from the vasculature. So there is like bloating sensation, there is um, pain, abdomen pain, because of the stretching of the jejunum, and because of that sudden movement of the fluid from outer compartment to inner. There might be sweating. I think tachycardia is in late, sir. Is maybe here. I'm not sure.
So,
Palpitations are seen, sir.
cardiovascular
Yeah.
symptoms like palpitations, tachycardia, everything, occasionally blurred vision, right? And this early dumping is more common after partial gastrectomy with Billrod type 2 construction, and less common with Billrod type 1 gastrectomy. That's what we need to remember. So, why does early dumping occur? Whenever you have done gastrectomy, or if you have interrupted the pyloric sphincter mechanism, then suddenly food of very high osmolarity will enter from the remnant of that gastrectomy. Remnant is there, no, doctor? So, through that, it will enter directly into the type 2 Billrod, no, it is more common. So directly enter into the jejunum. So, and that rapid shift of extracellular fluid from the intestinal lumen lead to the luminal distension. See, when high osmolar food comes into the jejunum, no, it will suck the water from the plasma, and
Yes.
that rapid shift will cause luminal distension. The moment your lumen is distended, there's a lot of autonomic response. That's the reason you get all these cardiovascular symptoms, is what you need to remember. Whereas in the case of the late dumping, whenever the food with high carbohydrate content, the symptoms occur 1 to 4 hours later, that lead to reactive hypoglycemia along with the vasomotor symptoms. Vasomotor symptoms are common to both early and late dumping. But late dumping, typically what it will do when high carbohydrate content get enter into the plasma very fast, that will stimulate insulin, and that insulin will lead to hypoglycemia.
Hypoglycemia.
So that is the main thing. So which symptoms that you see in early dumping are not there in late dumping?
Early dumping, you in late dumping you have
Abdominal,
hypoglycemia.
abdominal cramping, pain, which you
There's
see
not there in late dumping.
in early dumping are not the feature of late
Late
dumping is what
dumping.
we need to basically remember. In the case of early dumping, you have abdominal pain, diarrhea, borborygmy, bloating, nausea, flushing, palpitations, perspiration, cardiovascular symptoms. In late dumping, you get hypoglycemia and all the sympathetic symptoms, but not why abdominal pain, diarrhea, borborygmy, bloating, nausea will be there? Because in early dumping, the
Stretch.
food is suddenly entering into
The
jejunum,
jejunum, sir. Yeah.
and that is causing a lot of hyperosmolar contents of the food in the jejunum that will suck the water into the from plasma into the gut, and that sucking of the water will cause the abdominal distension, abdominal pain, diarrhea, bloating, etc., etc. Clear? So early dumping, typically, what are the features? Late dumping, what are the features? You need to be very sure about. Now, doctor, 20-year-old female, pain in the right hypochondrium, nausea, vomiting from 2 days. What do you want to do?
You'll do an ultrasound here, sir.
Very good.
Sir, initial investigation is always ultrasound, but if you take gold standard, it's HIDA scan here.
See, fundamentally, ultrasound will is a easy thing to do, high sensitivity. It can identify calculi in the gallbladder, and it will also identify whether there is any CBD, common bile duct distension, I mean dilatation if it is there. And also it can identify any thickness of the wall of the gallbladder and pericholecystitic fluid in case of cholecystitis if it is there in the patient. And also sonographically, what is Murphy's sign?
Uh,
Murphy's sign
I
in the right hypochondrium, when you are palpating, then you are touching the
probe
inflamed
to,
gallbladder.
yeah.
So ask the patient to take inspiration. So when he takes inspiration, the lung will expand, diaphragm moves down, and that gallbladder will come to touch the examiner's palm, and that lead to sudden pain, and patient will hold the breath. That is called Murphy. That you can even elicit with the ultrasound probe also. That's called sonographic Murphy's sign. Okay, so that is all the story, doctor. So if you look at ultrasound versus HIDA scan when it comes to the cholecystitis, gold standard is HIDA, immunodiacetic acid scan, right? But initial investigation is always ultrasound. Immediate available, easy to access, no ionizing radiation. You can identify the stone, etc., is what you need to remember. So, doctor, risk factor for esophageal carcinoma, what are they?
It's all except beetle chewing.
Yeah. So, uh, gastroesophageal reflux disease, nitrosamines, tylosis, they're all the risk factors. So, you should know
Factors.
a list of risk factors. Come on, what are the list of risk factors for adenocarcinoma, doctor, of esophagus?
Barrett's, GERD, hiatus hernia, Zollinger-Ellison syndrome, obesity, smoking, male gender, and it's more in Americans than African.
Similarly, if you look at squamous cell carcinoma, what are the most common location of squamous cell carcinoma of the esophagus, doctor?
It is the upper
Mid
part of
esophagus,
mid esophagus. Lower esophagus is adenocarcinoma.
adenocarcinoma. That's what you need to remember. And Barrett's esophagus is for adenocarcinoma. It is
Adenocarcinomas.
risk factor. दारू पिए तो क्या मिलेगा?
Squamous cell carcinoma.
और स्मोकिंग करे तो दोनों मिले
Adenocarcinomas. Dono,
adenoma
it's a
is
part.
squamous be. In fact, squamous is ninefold risk with
Smoking.
smoking. And achalasia is a risk factor for
Squamous cell.
right. So this you need to be very, very clear about. Suppose if you eat aloo breakfast, आलू डिनर, आलू लंच, तो हम भी आलू बन जाएंगे. और हाई स्टार्च डाइट विदाउट फ्रूट्स एंड वेजिटेबल्स आल्सो इज अ रिस्क फैक्टर फॉर squamous
Squamous
cell
cell carcinoma.
carcinoma is what you need to remember. Similarly, human papilloma virus is also a risk factor for
Squamous cell
squamous cell.
carcinoma.
Anybody try suicide with caustic, drinking caustic, that lead to strictures in esophagus. That also becomes a risk factor for squamous cell
Squamous cell.
carcinoma, is what you need to remember. Very good. Meghaswana rightly says upper two-third squamous, lower one-third is adeno. Very good, doctor. So Meghaswana, Madhuchandana, anybody who want to join the discussion, please let me know. More the merry. We will all study together. Ganesh, I'll send you the questions beforehand. Prepare for all the 200 questions. Along with the answer, along with the key I'll send you, and we'll look together and have the discussion. So that way what happens is you won't feel the stress that only teacher is blabbering, 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 you feel sleepy. But now you are very active. You're not feeling, I won't let you to sleep that easily, right? So Mithuna, are you feeling sleepy?
No, sir. Oh, sorry, sir.
Good. Your dog is also not feeling sleepy. Now, left kidney transplant. Where do you put it, doctor?
It's in the iliac fossa, sir.
Very good. So, left kidney, why do you prefer for renal transplantation?
Because of the longer left renal vein.
One of the very favorite questions of the examiner. Don't tell, because most surgeons are right-handed, they will put the left kidney. They're more easy to pick up. The left kidney should not be your answer, because of the longer left renal vein is what you need to remember. And renal graft is placed in the iliac fossa and leaving the native kidney in situ. Original kidney is kept, only connection is removed, right? And original kidney given by God is in retroperitoneal location, whereas renal graft is placed in iliac fossa. Now, doctor, Niti Ayog represents.
National Institute for Transforming India.
Very good. So, National Institute of Transforming India. So it is typically formed on 1st January. Modi ji, when he is Prime Minister, there will be definitely one question on Modi. Oh, Modi is also one sure shot MCQ, and all the Modi schemes. Now, on Republic Day, camp was organized, screened for hypertension by checking the BP and diabetes. What do you like to call this?
This is secondary level of prevention because you're trying to identify the disease which is already present in the patient.
Very good. Whenever we do early diagnosis and treatment, we call that as secondary prevention. Person comes with right eye 6/60, left eye 3/60. What type of blindness is he having?
This is low vision, or it's also called as economic blindness, sir.
Very good. So let's quickly take up, doctor. For you to call normal, what is the visual acuity in the better eye?
It is in between 6/6 to 6/18. Can
You
see
call
6/18 better.
impairment. When do you call visual impairment?
Visual impairment is less than 6 by 18. Uh, uh, but they can see, yeah, 6 by 60 tak.
6 by 18 to 6 by 60. He
That is,
can
they
see,
cannot see. They
cannot
cannot see
see.
6 by 18, sir. Yeah.
Severe visual impairment or economic blindness is,
Economic is cannot see 6 by 60, but they can see 3 by 60.
and when do you call social blindness?
Cannot see 3 by 60, but can see 1 by 60.
Very good. Legal blindness.
They cannot see 1 by 60, but they can only perceive light.
Very good. And when do you call blind?
Blind, even they cannot perceive light.
So these are the important things you need to remember, doctor. So social blindness is vision 3 by 60 or diminution of field of vision to 10 degrees. Manifest is vision 1 by 60 to just the perception of light. Absolute blindness is no perception of light. You need to be very sure. So WHO said 6 by 6 to 6 by 80, normal vision less than 6 by 80 to 6 by 60 is visual impairment less than 6 by 60 to 3 by 60, severe less than 3 by 60 to NPL is blind, this is what you need to remember. So doctor, recyclable tubings, catheters, they'll be put in which color bag?
All recyclables go into red, sir.
They go into red. Very good. So quickly tell me, yellow, what are they?
All anatomical wastes are into yellow. Discarded medicines, expired medicines, even chemical waste, all this go into yellow. And red may you have all recyclables like the catheters, used IV fluid bags, tubes, any kind of tubes, syringes, but without the needles. All these go into red, and white translucent is all the sharps. All the needles which have been broken, they are into this. You have hypochlorite solution into it. And then blue may you have all glass, all the vials, glass, any metal implants too.
So expired,
Yeah,
cytotoxic, discarded, unopened vials is yellow. Broken, discarded, opened vials is blue.
blue.
Is what you need to remember. So ये सब चीजें ऐसे होते हैं डॉक्टर, जितने बार बट्टी मारो उतने बार भूल जाते, मगर भूल जाने के ऊपर फिक्र नहीं होना, रट्टा मारते ही बैठना, और वन डे एग्जाम हो जाएगा और फॉर एवर यू विल फॉरगेट इन लाइफ. So until then, you need to do revision, right? What is the main focus of UNICEF?
Anything UNICEF is all child health, sir.
Right. Which is cardio protective.
HDL.
So normal values are important, doctor. एक मर्तबा फटाफट बोलो बेटे. VLDL,
10 to 30.
LDL,
80 to 150, sir.
HDL,
35 to 60.
total,
150 to 200.
serum triglycerides.
50 to 150.
Please remember, subacute sclerosing panencephalitis is a complication of.
Measles, sir.
Very good. So the whole brain becomes shrunken, doctor. I have seen only one case of subacute sclerosing panencephalitis till now. Very bad shape the patient is on. What's spermicide used in contraceptives?
Nonoxynol 19.
Very good. So today is the one nonoxynol spermicide, and it can be removed after 8 to 24 hours, but not before 6 hours. Main side effect of any today like sponge is obviously your placing
Staphylococcal.
the vagina. It lead to tapoon,
Toxic
can lead
shock
to
syndrome.
toxic shock syndrome. Coplic spots.
Measles, sir.
Very good. So these are the typical coplic spots which is going to come in the tomorrow's exam as a spotter. Sustainable development goals. Who designed that, doctor?
United Nations.
Very good. So there are 17 sustainable developmental goals, goal 1 to goal 17. You need to be quite sure. So transforming our world, 2030 agenda for sustainable development by the United Nations is what you need to remember. Kyoto Protocol is for what?
This is to reduce the greenhouse gas emissions, is said Japan, sir.
So to reduce the greenhouse gas emissions, we use the Kyoto Protocol is what you should remember. Now, a 40-year-old male presents with fever, abdominal pain, diagnosed with HIV and TB. How will you give a treatment?
Always treat TB first, then followed by the ART.
Very good. Always TB first, then comes the HIV. TB तो जिंदगी तमाम नहीं रहता. ART तो जिंदगी तमाम रहता. So that is the reason first to deal with the boyfriend and then with the husband. So because ये तो जिंदगी तमाम रहता है HIV के जैसे, so उनको बाद में हम ART दे सकते. So Africans have all population given chemoprophylaxis. What is this an example of?
This is primary, sir. Vaccines
Very
and all
good.
are primary.
Very good. So chemoprophylaxis always comes under the primary form of prevention is what we need to remember, which is not a measure of dispersion.
Mean, sir.
So range, variance, standard error. They will tell you how the data is being dispersed is what you will be able to know. So range, variance, and standard deviation. For severe malnutrition, what should be, what is the mid arm circumference less than?
12.5, sir.
Very good.
12.5 centimeters.
And when do you call severe acute malnutrition?
Less than 11.
And normal is?
More than 13.5.
Very good. So I'll leave the literature quack stick method. In that, typically to know the nutritional status. So the quack stick utilizes a rod which is colored with green, yellow, and red, and the upper zone is red. Red means severe PM, and yellow means borderline, green is normal nutritional status. Then this is another favorite question. Triceps skin fold thickness. What is the normal value?
It is normal is above 10 mm, sir.
1
Skin
centimeter.
fold.
Yeah. And less than 6 is severe.
Severe malnutrition.
10 mm is mild to moderate malnutrition.
Malnutrition.
And what is mid-arm muscle circumference? It is mid-arm circumference minus 3.14 into triceps skin fold thickness is what you need to remember. There is one more method called bangle method. Where do we use this?
In preschool.
Preschool children.
Preschool children.
A bangle with a diameter, how much diameter?
4 centimeters.
Very good. And it is not very reliable anyway. So Quetelet index, what is the formula for it?
Weight in kgs into 100 by height in centimeters.
Square. Centimeters
Centimeters square. Okay, sir.
Dugdale index is?
Weight in kgs by height in centimeters into 1.6.
So these things, Dr. Little ratta marne wala items hai, but still ponderal index is another favorite question of the examiner.
Ponderal is weight in grams by length in centimeter cube into 100.
Height to the power of 3.
This is for IUGR. Yes, sir.
Height to the power of 3 into 100 will give you ponderal index is what you need to remember. So I leave the literature, try to take opportunity to retain, remember it once more. So in marasmus, mid-arm circumference is less than?
It's less than 15, so 15 centimeters.
Very good. So marasmus Kwashiorkor, merasmic kwashiorkor. So to call it as merasmus, you need to know that mid-arm circumference is less than
15 centimeters.
15 centimeters. Weight less than
80%.
tricep skin
80%.
thickness
Less than
3
3 mm.
3 mm. Thickness of the tricep skin thickness,
Skin.
doctor. It won't be centimeters, no.
Yes, sir.
Right. Now, every time you are having difficulty to swallow the fact that cm, right? So mm only it will be, not cm. Huh?
Yeah.
Now, what is the chemoprophylaxis of choice when you go to endemic malarial area?
It's chloroquine, sir.
What is that?
Chloroquine, sir. C.
Chloroquine. Very good. So chemoprophylaxis, it should be started how many weeks?
It is 1 to 2 weeks prior to the travel, and then you
Travel.
continue it for another 4 weeks.
1 to 4 weeks.
4 weeks.
Whenever chloroquine sensitivity is there, it is the chloroquine. But if the chloroquine resistant Plasmodium falciparum, then what will you give?
Chloroquine again,
Chloroquine
but
only. Chloroquine only. If it is a low degree resistance, then you should use chloroquine only plus proguanil.
yes,
Suppose if it is a very high chloroquine resistant area for Plasmodium falciparum,
chloroquine plus proguanil or mefloquine is 2 to 3
mefloquine
weeks before.
before. Or doxycycline
Doxycycline
started 2 days before.
before.
Or etoboquone plus
Yes.
proguanil
Proguanil.
to be started 2 days before. So these protocols are very important, doctor, because one MCQ, sure shot to come in the tomorrow's exam. So what are the chemoprophylaxis for the travelers to India?
It's chloroquine.
So once more, high altitude states like JK, Himachal, Sikkim, mosquitoes ही नहीं रहता ना उतना ऊपर. हम गए तो ही मर जाते वो ठंड में, तो मस्किटोस मच्छर कहाँ जिएगा? Malaria transmission is very low at an altitude above 2000 meters. At least that is one advantage. To go to hill station में seat आ गया तो शिमला में, that is your dream destination, right? So whenever it is more than 2000 meters. So whenever Plasmodium falciparum endemic areas, anybody coming from America, then they need to take doxycycline 100 mg once a day as the drug of choice for short-term prophylaxis. Whenever a traveler is coming to India, is what you need to remember. So during pregnancy, which drugs are preferred is the favorite question. First 3 months of pregnancy, what are the drugs preferred, doctor?
Chloroquine and proguanil.
And can you give mefloquine in the first trimester?
No.
No. It is given in second and third trimester. And non-pregnant women with childbearing potential है तो क्या दे सकते हैं आप?
Mefloquine with doxycycline.
Doxycycline. During pregnancy, what drug is contraindicated? Doxy is
Doxycycline.
contraindicated. Similarly, primaquine should not be used during pregnancy because the drug may be passed transplacentally to unexpected G6PD deficient fetus and can lead to death of him. So that is the main point to be remembered. So we took 1 hour to finish 54 questions, doctor. Not bad, eh? Not bad. Not a bad speed, right? Now, yellow fever is valid up to, we'll finish
It's
100
live.
MCQ and call it a day. Huh? Are you ready for that? Or do you need a break?
No, sir, no break.
Okay, good. So, is valid up to?
It's lifelong, sir. 17D is the strain.
Very good. Lifelong protection for most of the people, right? So whenever you are going to Mauritius or Africa for honeymoon, then you need to take one shot of yellow fever vaccine. All are components of Kupuswami scale. What are the components of Kupuswami?
It is Kupuswami is all about the head of the family, sir. So whether he has got any education, what kind of an occupation, and how much of income is coming. So I think the question's little wrong, sir. What are the components of Kupuswami's D? That's the answer.
Is the correct question. Correct. Education of the head of the family, occupation, income per month from all sources are under the Kupuswami. So once more, a little ratta marne wala item. Lower class means below 5, upper middle is 16 to 25, upper is 26 to 29. So what are the most sensitive test, doctor? Megaswana, Itman, Madhuchandana, Ganesh. Am I loud and clear for all of you? Can you please punch? Now, doctor, what is the most sensitive test?
It is the membrane filter concentration technique.
Very good. So there is a membrane filter concentration technique which is considered to be the most sensitive and not a concentration method also it is called as for detection of microfilaria. Vaccination and mass chemoprophylaxis, what does it represent?
Specific protection, sir.
Very good. So specifically, you are giving something like tetracycline for chloroquine for cholera, dapsone for leprosy,
Leprosy.
chloroquine for malaria, vitamin A in children, iron folate in pregnant. Using helmet and seat belt is also specific protection. Now, patients are categorized on the basis of chances of survival. What is that called in disaster management?
Triad, sir.
Very good. First to come, no first to come,
no
first
first
treated.
come, first treated. So the color based severity.
It is how severe based on that. High priority, low priority. That's how we divide the students, patients into. So, you are in which stage of triad, doctor, in preparation? Immediate.
Red, yellow.
Wounds, shock, open fractures, 2 to 3 burns. Notification came recently injured in NEET PG. Comes under immediate. And some students just passing out internship shortly, delayed. Yellow, stable, abdominal wound, eye and CNS injuries. All the third year, fourth year folks are all final year guys. Green, minor burns, minor fractures, minor bleeding. And first year, second year में ही शुरू करते हैं ना coaching. That is black, unresponsive. Omo. This is black.
Dead.
Not first year. All PhD doctors. Right? 10 years हो गया preparation. Black. Unresponsive, high spinal cord injury. So which is not a contraindication of OPV.
It's diarrhea, sir.
Live attenuated or killed, doctor?
It is live attenuated, Sabin, sir.
Very good. So, which is not a contraindication?
Diarrhea.
So, malignancy, leukemia, immunocompromised state, HIV positive with immunocompromised state, they're all the important, even pregnancy is an absolute contraindication for giving OPV, is what you need to remember. Under Vision 2020, what was the disease that was added in India?
Glaucoma was added, so later.
Very good. So, cataract, childhood blindness, refractive error, and low vision, corneal blindness, glaucoma, diabetic retinopathy, and trachoma is fortune. Trachoma is safe sterility. You know that, right? So, during pregnancy at 37 weeks, mother is found to be HBsAg positive. What do you want to do to the baby?
Baby has to receive hepatitis B vaccine along with hepatitis immunoglobulin.
Very good. So both passive immunization, which does not elicit any immunological memory, along with active uh,
Immunization.
immunization, which is with a killed
Memory
vaccine.
kill vaccine.
Hepatitis
Yes, sir.
vaccine. Keshan's cardiomyopathy is
Selenium, sir.
selenium deficiency. So what is this
It's a sandfly, sir. So Kala Azar.
sandfly? Very good. Sandfly leading to Kala Azar. Contraceptive which is contraindicated in DVT is
DVT, it's OCP, sir.
because OCP has estrogen and estrogen is prothrombotic.
Prothrombotic.
What is absolute contraindication for IUCD out of this?
It's acute PID, sir.
Very good. So, pregnancy, pelvic inflammatory disease, puerperal sepsis, immediate post-septic abortion, severely distorted uterine cavity, unexplained vaginal bleeding, cervical cancer, endometrial cancer, malignant trophoblastic disease, copper allergy, breast cancer, and relative contraindications, absolute contraindications, 100% you should be sure for the tomorrow's exam. So, what is the contraceptive advice for a newly married couple, doctor?
It's OCP, sir.
Very good. So, it is the OCPs. Anthracosis is caused by
Cold, sir. Coal dust.
coal dust. Very good. So, this is all the anthracosis caused by the coal dust. Very good to see 17 online classmates. Excellent, doctor. To study alone is boring. To study together, हम पूरा दिन बैठ के पढ़ाई कर सकते. So we want to stop this anarchy of monologue delivered by national faculty, book authors, and all that gibberish, not required. You will learn more, you will learn enjoyably when you have Aam Admi in the broadcast. So, Mithuna is our Aam Admi student, right? Who, with 1 month preparation from not qualified last year, she could become 75,000 rank. So, my promise to Mithuna and many students like Mithuna is let us all study together. Let us do the revision of PYQs together. You want to join the broadcast, please let me know. Please ping me in the WhatsApp. And I'll send you beforehand the questions with answers, with explanations. Prepare well, join the discussion. Let us finish a group revision. That way, it will be very interesting for all of us. Right, doctor? So, thank you very much for being part of the broadcast. Whole thing is what, doctor? How to not get bored, right? To how to be happy, enjoy the preparation. How will you screen vitamin A deficiency in school, doctor?
It's night blindness, sir.
Very good. So, completed family size means
Number of children.
number of children. It is not the number of women that a man married. It is the number of children. Average number of live born children for the woman who has assumed to have completed their childbearing. 100% mortality disease. Incidence and prevalence relationship is?
Prevalence equals to 1.
No. Relation between prevalence and incidence. Incidence is new
So,
cases, doctor.
yeah,
Prevalence,
prevalence is old, sir. Old plus
incidence,
new.
I mean, new plus
Old.
old case. यहाँ क्या हो गया 100% मोर्टेलिटी है ऑल ओल्ड केसेस मर गया
सिर्फ इंसिडेंट्स बचे हैं.
so incidence is new cases only prevalence is new plus old but old मर गया so 100% mortality like covid huh? So only all cases left are new cases so prevalence become equal to incidence.
Incidents.
SARS is caused by novel variant of
Coronavirus.
Oh, come on. B12 lead to which anemia?
Macrocytic normochromic anemia.
Macros normochromic and megaloblastic. So, microcytic anemia, what are the four causes you will remember like a parrot for the tomorrow's exam?
It's iron deficiency, sideroblastic anemia, thalassemia, and anemia of chronic disease.
Then macrocytic normochromic is
It's the megaloblastic anemia because of B12 or folate deficiency. Liver disease also can lead to macrocytic normochromic, even in post-splenectomy.
correct. After splenectomy also. Once more, macrocytic anemias can be divided into megaloblastic and non-megaloblastic.
Non-megaloblastic.
So liver disease, hypothyroidism, alcoholism. These three are responsible for macrocytic megaloblastic.
Non-megaloblastic. Yes, sir.
Whereas B12 folate is responsible for megaloblastic.
Megaloblastic.
What you need to remember. N95 respirator is used for
Airborne precautions.
very good. So worms, bugs, bacteria attached to the clothing is called
Contamination.
contamination. Target couple, who are they?
Target couple is who are practicing family planning. Eligible couple is that reproductive age. Married couple between that wife being that in between 15 and 49 years.
Very good. So eligible couple is a newly married couple wherein the wife is in reproductive age between 15 to 45 years. Target couple is when the couples who have had 2 to 3 living children or even newly married couples to make them to accept the idea of family. That
Family
means
planning.
they are not practicing yet, right? So that is target couple is couples who have 2 to 3 living children or even newly married couples to make them to accept the idea of family planning at the earliest is target. Eligible is whenever the wife in the reproductive age group between 15 to 45 and newly married. That is very, very important. Then there is a difference between fertility, fecundity. Fertility is the number of live births a woman actually had. Fecundity is the ability of the woman to conceive is called fecundity.
Fecundity.
Fecundity cannot be known unless fertility is proved. That is a point you need to appreciate. Now, how many teeth in the primary dentition, doctor?
20, sir.
20 teeth. Patient with pink color skin and mucosa, bitter almond smell from the
Cyanide, sir.
breeze. Very good. Cyanide poisoning. Then farmer presenting with pinpoint pupil and increased salivary secretions.
OP poisoning, sir.
Many times we have seen because OP poisoning will inhibit which enzyme? Cholinesterase.
Cholinesterase. Cholinesterase.
Esterase. Because of that, whose concentration will increase?
Acetylcholine.
And that lead to increased
Increased secretions.
Parasympathetic stimulation lead to what? Meiosis.
Meiosis, sir.
Oculomotor nerve palsy में parasympathetic paralysis is there. That lead to mydriasis.
Mydriasis.
Oculomotor nerve palsy. Clear? Now, which part of the brainstem bleeding will lead to pinpoint pupil?
Pontine hemorrhage, sir.
Very good. Pontine hemorrhage can lead to pinpoint pupil. McNaughton's rule is which IPC?
84.
Very good. So Daniel McNaughton Circa 1856 में, so section 84 IPC is McNaughton. So rule is 4, Norton is 8. प्रॉब्लम क्या होता है ना ऐसे निमोनिक्स में नॉर्टन का स्पेलिंग भूल जाते हैं. Then poisoning caused by bullet retained in the body
Lead
is
poisoning. Lead poisoning,
lead.
sir.
Then during examination, hair bulbs are crushed. What type of wound may?
It's laceration, sir.
Laceration. So typically the edges become irregular, ragged, bruised, and blood vessels are crushed. External hemorrhages may not be marked. So that is all about the lacerations. So lacerations versus incised wound. Quickly tell me, doctor, 3 points about lacerations.
Lacerations, hair and hair bulbs are crushed, but in incised, they are not crushed. Edges in the lacerations are bruised, but edges are very clear and non-bruised in incised. And base of the wound has bridging across the muscle fibers. There's no bridging in the incised wound.
Very good. So once more, tomorrow नीट पीजी में क्या होता है ना, और INICET में ये सब पढ़ने में बोर लगता है. कोई साथी के साथ पढ़े तो मजा आता है. So the whole idea is discover a study partner. What you need is not a national faculty or a app-based video teacher. What you need is another compatriot soldier who is also laboring to master all this stupid nonsense called NEET PG study material. That is what you require, doctor. And we love to be that dumb idiots to study along with you because we know nothing. We are also like never read forensic, but come to study along with you. So tell all your friends. Dr. Murli Bharadwaj classes may dumb idiots will teach to help dumber idiots to prepare for dumber morons to prepare for the dumbest exam in the planet called NEET PG. I think that is Dumbo, like Marrow. Dumbo is a new app name, right? So good, doctor. In entry wound of skull, beveling is seen in.
It's the entry wound, inner table, sir.
Very good. So a bullet bevels out of the bone in the direction in which it is traveling. Mainly entrance and exit wounds, they differ by appearance. Internal beveling is a feature of entrance wounds, and the shape of the beveling. Suppose if the bullet travels like this, then the beveling will occur in that direction. If the wound travels like this, the beveling will occur in this direction. So that will tell about the direction of the fire. So in exit wound is larger than entry, and there is no scorching, abrasion, or grease, and there is a inward beveling of the skull at the point of entry is what you need to remember. So this is a entry wound, this is a exit wound is what you need to remember. So once more, doctor, quickly let us do a dumb revision on difference between inlet and exit wound. Size, which is large,
Exit is large.
which is everted edge,
Exit,
regular margins,
more regular is inlet, sir.
and powder marks,
Inlet,
no powder marks,
exit,
beveling is internal in.
inlet.
Very good. So now, doctor, in autopsy of a suspected poison, which organ along with the stomach, part of intestine and liver is preserved?
Kidney, sir.
Very good. So liver, stomach, small intestine, spleen, kidney, the viscera which are being preserved. So you have 4 bottles for the routine preservation. Bottle 1 may stomach with its content in proximal 1/3 of intestine. Bottle 2, half of each kidney and 500 grams of liver. Bottle 3 may 100 ml blood. Bottle 4 may only the preservative. So this is what is the routine viscera preservation. If you don't read this, lifelong forensic MD करने के बाद विसरा प्रिजर्व करते ही बैठना पड़ेगा. Liver in most circumstances, because it has many concentration of many things. When will you preserve heart? दिल को कब लेते हो?
Strychnine and digitalis poisoning.
Not if he died because of love failure. Then brain,
In any poisons which is neurotoxic, alkaloids, and organic, volatile organic poisons.
and also if he was a NEET PG topper in the past and died, there also brain should be preserved because lot of poisonous high yield facts will be there. So when will you do bile?
Bile is in cocaine, in barbiturates, tranquilizers, opiates,
So
glutathione, narcotic drugs, sir.
very good. And lung,
Any kind of gaseous poisons, cyanide poisoning because of the cyanide gas, alcohol, and chloroform.
and vitreous humor,
Alcohol, chloroform, in that two conditions it is preserved.
bone.
Bone is antimony, arsenic, thallium, radium, metals,
So these are the things that you need to remember. Oh my
radioactive,
God. Spinal cord, very important question.
strychnine.
Body fat,
Body fat is organophosphorus. No, organochlorins. Indrin. Oh,
chlorides.
okay.
So
Pesticides. Oh.
yes, and these are some of the points that you need to remember, doctor. So another important thing, what preservative will you use? Saturated salt solution. मतलब जरा नमक पानी में डाले हुए लिक्विड को यूज करके. In all cases of poisoning
Except acid poisoning, carbolic acid poisoning.
no, in all case of poisoning
Okay,
except acid
except
poisoning,
acid
but
poisoning, but
carbolic
carbolic.
acid, even though it is acid, still you use
Saturated
namak
salt solution.
saturated salt. For
Okay.
acid poisoning, except carbolic acid poisoning, what will you use?
Rectified spirit.
Very good. So carbon monoxide poisoning,
It's paraffin.
and all cases of poisoning, including alcohol poisoning for blood.
Sodium fluoride and potassium oxalate.
So please don't forget, one question pakka aane wala question hai, you can't help it out there, right, doctor? Now, what is this hemorrhage?
It's outside the dura, so it's extradural hemorrhage.
Very good. Hypoxic hypoxia. Where do you see?
I don't know this. AV shunt, I know the answer, sir, but I didn't read the whole this thing behind it.
So hypoxic hypoxia. Whenever you go to a high altitude, atmospheric air only has a decreased PO2. So even if you are breathing normally also, you will go into hypoxia. Similarly, any obstructive lung disease where gaseous exchange doesn't occur, restrictive lung disease, depression of respiratory center, respiratory muscle paralysis, they all lead to hypoxic
Hypoxia.
hypoxia. So when do you call hypoxic hypoxia? Whenever saturated oxygen saturation is low, you call hypoxia.
Hypoxia.
In that, in other conditions of hypoxia, PO2 is normal. Partial pressure of oxygen is normal. But oxygen saturation is low in other type of hypoxias. But saturation of the oxygen is low, and even the PO2 is also low. Then you call
Hypoxic hypoxia.
exactly is what you need to remember. So hypoxia can be hypoxic hypoxia, where there is a low arterial PO2, low atmospheric PO2, or inadequate ventilation, whatever. Whereas anemic hypoxia means normal arterial PO2 because of the reduced hemoglobin, is what you need to remember. Now, doctor, what is the most potent opioid?
Fentanyl, sir.
Fentanyl. Fentanyl, right?
Yes, sir.
So most potent. Ultra short acting. What is the
Alfentanil.
all fentanyl? Most potent.
Sulfentanil.
Sufentanil.
Sufentanil.
Sufi music is very powerful, right? Sufentanil is more 5 to 10 times more potent than
Fentanyl.
fentanyl. Shortest acting opioid is
Remifentanil.
and very rapid offset. And carfentanil is an analog of fentanyl, and its analgesic potency is 10,000 times that of morphine. So tomorrow, when you become oncologist or oncosurgeon, pain management in terminally cancer patients is one of the biggest area, doctor. Tomorrow, when you become anesthetist also, right? So now, what is the mechanism of action of allopurinol?
Xanthine oxidase inhibition, sir.
Very
Enzyme
good.
inhibition.
And which drug causes postural hypotension?
Alpha blockers. Central acting drugs.
Alpha blocker. Huh? So you have it is not centrally acting. You have alpha 1, alpha 2. Alpha 2 is presynaptic, which is there in the brain, central. Clonidine is a drug which is alpha 2 agonist, is what you need to remember. When you stimulate alpha 2, which is presynaptic, it inhibits the sympathetic release. That's the reason the BP will
Hypertension.
come down.
Come down.
That is how clonidine alpha 2 agonist, alpha 2 is presynaptic stimulation lead to alpha 2 sympathetic
Hypertension.
outflow decrease,
Sympathetic.
and that will decrease the BP. Will you remember?
Yes, sir.
So clonidine is which agent agonist?
Alpha 2.
2. And where is the clonidine acting? Peripheral or central?
Central. Presynaptic.
Central.
Yeah.
Very good. And whenever the alpha 2 is stimulated, what will happen to sympathetic outflow?
Decreases.
Decreases. Then where are alpha 1 receptors? They are there on the blood vessels.
Vaso.
Alpha 1 stimulation lead to
Vasodilatation. Constriction, sir. Okay.
vasoconstriction. Vasoconstriction. This is an alpha blocker like prazosin. What is the common brand name? Mini Press Excel is a
Yes,
very
sir.
common brand name, right?
Yes,
So I mean, you don't need to remember this, but prazosin is alpha 1 blocker. So that alpha 1 stimulation lead to vasoconstriction, alpha 1 blocker will vasodilate
Vasodilate.
and
So
act like a antihypertensive.
Yeah. Okay.
But the problem with that is what? Whenever suddenly from a lying down position, when you go to a standing position, typically our blood vessels constrict so that BP is maintained. But here, for the blood vessels to constrict, the alpha 1 is blocked. That's the reason when you suddenly go into standing position, all the blood will pool in the periphery and the blood vessels don't constrict, and you will go into hypotension, which is postural hypotension.
Potential.
Okay. Then
Yes.
one more important thing. Can you tell me, Dr. Mithuna, what other drug that can lead to development of first dose hypotension? First time when you give that antihypertensive, that can lead to first dose hypotension. ACE inhibitors.
Okay, sir.
Always you need to be careful when you give ACE inhibitors first time, first dose hypotension can occur. All right. Now,
Yes, sir.
which is a carbonic anhydrase inhibitor?
Acetazolamide, sir.
Very good. And which is the most cardiotoxic anti-cancer?
Anthracycline, that is
Yesterday
doxorubicin.
only we discussed doxorubicin and daunorubicin.
Downrubicin.
Is there more prophylaxis of choice in a patient who goes to endemic malarial area?
Chloroquine, sir.
Very good. So chloroquine, doxy, mefloquine, etobaquone, propanil.
Propanil.
These are the common chemoprophylactic agents is what you need to remember. These are all used for the prophylaxis of the migraine, not acute management, except
Flutamide, sir.
so flutamide. So you should know for prophylaxis what they use, for acute management what they use. Propranolol, tricyclic antidepressants like amitriptyline, nortriptyline, anticonvulsants like divalproex, calcium channel blocker like verapamil. So preventive therapy at least 1 year you need to continue. 6 to more than 12 months may be required, and a full therapeutic trial can take 2 to 6 months. So, what is flutamide? Flutamide is a non steroidal, no hormonal
Hormonal
activity,
activity.
anti androgenic drug.
Okay.
It is not at all used in the migraine at all. Where is it used? It is anti testosterone. So,
Prostate cancer
prostrate along with
and
GNR
hirsutism.
is what you need to remember. So, a farmer presented with a pinpoint pupil increase secretion.
Organophosphate poisonings.
Very good. Therapeutic drug monitoring is done with which drug, doctor?
Phenytoin, sir.
Very good. So, phenytoin,
Narrow
it has
therapeutic.
nonlinear pharmacokinetics, highly protein bound, narrow therapeutic range, inter-individual variability. If I take phenytoin, there is
It
a
might
different
vary. Body to body
way
variation.
we metabolize, is what you
Yes, sir.
need to remember. Which is a oral direct thrombin inhibitor?
Dabigatran.
Dabigatran. So, bivalirudin, lepirudin, argatroban, dabigatran. So, ये भी रट्टा मारने वाला आइटम है, डेफिनेटली आएगा. Which are the drugs among these which are bivalent, doctor?
Bivalent is bivalirudin and lepirudin.
Lepirudin. And stroke prevention के लिए what do we use?
Dabigatran.
Which is the only oral direct thrombin inhibitor?
It is dabigatran.
Very good. And which is cleared by kidneys?
It is dabigatran and lepirudin.
And which is by liver?
Liver is by argatroban.
And enzymatic clearance is bivalirudin.
Lirudin.
So which drug typically follows zero order kinetics?
Just
Very
as
good to see 20 online classmates. Excellent, doctor. And let me tell you, be part of our WhatsApp study group. हम नेशनल फैकल्टी तोड़ी है और बुक ऑथर्स बिल्कुल नहीं है, एक जमाने में भी लिखे थे. So, but we are a maverick group of NEET PG aspirants who did not qualify in the recent NEET PG. That's our brand value. But we have sincerity, honesty, truthfulness to give our best shot in this INICET, mastering as much as possible of the most focused high yield content, right? So be part of our cohort, be part of our broadcast, be part of our satsang that we will study together is the promise. So I post the chat group. Please be part of the group, join the WhatsApp group, and we'll study together. Which drug follows zero order kinetics?
So here the answer is phenytoin and aspirin also.
Very good.
One more is ethanol, so just 3 drugs which follow zero order.
Excellent. A lady has taken medication for amoebiasis. In a party, she drank daru and has nausea, vomiting, giddiness. Which anti-amoebic drug interacts with alcohol, doctor?
It's metronidazole, so it's that disulfiram like reaction.
Disulfiram-like reaction. So drugs causing disulfiram reaction. Once for all, let us remember, revise doctor, what are the 5 drugs? Fatafat bolo, Mithuna.
Sulfonyl ureas, procarbazine, which is anti-cancer drug, cephalosporins, griseofulvin, and metronidazole.
Very good. Which cephalosporins?
Cefotetan and cefoperazone. This is, I think, class 3, sir.
We'll check that.
Yeah.
If we are brilliant, whether it is class 3, then we won't be in this broadcast, right? We will check that, no problem. Which anti-asthma drug is avoided with erythromycin, doctor?
Theophylline, sir.
Very good.
P450 inducer.
Because you need to know that what are the drug interactions of theophylline. So what are the P450 enzyme induction drugs? Rifampicin, phenobarbital, carbamazepine, and ethanol. Similarly, smoking will clear the theophylline very fast. High protein, low carbohydrate diet, barbecued meat, childhood. Then what will decrease the clearance of theophylline so that theophylline toxicity can occur? All P450 inhibitors, cimetidine. Come on, tell me what are all the drugs you want to remember?
Cimetidine, erythromycin, fluoroquinolones, allopurinol, xylitol, fluoxamine, phenytoin, fluconazole, ketoconazole, acyclovir, ritonavir, diltiazem, verapamil, interferon alpha, estrogens, and pentoxifylline.
Very good. Then, what are the systemic conditions that can lead to theophylline toxicity? Favorite question of the examiner. Batti, ratta marne wala item hai. फटाफट बोलो.
Congestive heart failure, liver disease, pneumonia, viral infections, influenza vaccination, high carbohydrate diet, and old age.
Very good. So, last 2 questions before we call it a day. A patient after valve replacement require what?
Warfarin.
In the follow-up.
Warfarin.
Very good. Warfarin. So, aspirin, warfarin, goal is 2 to 3 in aortic valve replacement, and goal is 2.5 to 3.5 for mitral valve replacement or aortic valve replacement with risk factors. You should basically remember. What is the antidote for opioid poisoning?
Naloxone.
So once more, thank you so much to all of you, doctor, and Dr. Mitra, for participating. We'll once more, time मिल गया तो early morning भी पढ़ सकते, right? Afternoon भी पढ़ सकते, कभी भी पढ़ सकते. I'll send you the questions. You all prepare. Come to the class with some preparation. फटाफट मजे में revision करेंगे, right? So once more, we'll meet tomorrow. Thank you.
Bye, sir.